Hi, I'm Dr. Ashish Davalbhakta at Aesthetics Medicine and Advanced Aesthetics in Pune. In today's educational video, we are going to cover a very popular procedure called facelift. I'm sure there are a lot of people who heard about facelift as a procedure and would like to learn more. So facelift in Latin or in medical terminology, the right word is rhytidoplasty. So that's the Latin word for it, but it basically means facelift. And as the word suggests, it is lifting the tissues which have sagged with age. Now let's first understand why is a rejuvenation procedure like this necessary. There are three things that are happening, and I think I have covered it in one of my earlier videos. As one ages, there is a deflation that happens. That means the volume in your face shrinks, the fat pockets, they shrink, even the bone shrinks a bit as you grow older. The skin, which is normally nice and elastic, becomes inelastic, and in the third thing that happens is gravity then pulls it down. So a deflated content, an inelastic cover, and then the cover sags down. And then you see the effects of the sagging as we grow older. Now, aging starts actually from mid-20s. You start seeing changes and there are some races where they age faster than the other ages, and of course your lifestyle also contributes to the aging process, which is basically these three things that are happening. If you look at somebody when you're meeting them for the first time, naturally your mind will start to ascertain what the age of that person is. And if you look at this picture here, you can see that those in 20s, and then if you look at them in the 40s and then at 60s, you can easily make out there are changes that have happened, and you can say that, oh, this person is probably in mid 40s or mid 60s. And why is that possible? That's because your brain is trying to look at the changes in the face and trying to compute what the person's age probably is. So there is a definite progress in the aging changes that happen, which help you to ascertain a person's age by just looking at them. So we, in our science in anti-aging, we look at these changes and we try to reverse them or slow them down. And that's how we help people look fresh or young, by working on these changes that are happening. Changes differ from area to area, and one of my earlier videos has covered all of that. Facelift is indicated when you have all the three changes. There's deflation, lack of elasticity of the skin, and sagging. And what it basically does, it works on the mid and the lower face, that is mid face, lower face, and even the neck, and helps in lifting up the things that have sagged, the tissues that have sagged, and helps in putting them back into their proper place. And that gives you a rejuvenation effect of 8 to 10 years. And that not only helps in tautening the skin, but lifting up the tissues that have sagged, and it's a permanent correction. 8 to 10 years for sure. We can't stop aging, but we can, you could say that you would look 8 to 10 years younger than your peers or your contemporaries, and you will always look that many years younger. But you would of course age from 8 to 10 years back. That's the improvement. The most noticeable improvement is the freshness. I mean, your face starts looking fresh, the circulation of the skin component improves, and the skin starts looking healthy as well. So what are the changes that get corrected? Or in other words, you could say, if you had these issues, you should consider a facelift. So a person who has deep nasolabial folds, these are nasolabial folds if they're very deep. If you've got tissues kind of folding over the nasolabial lines, if you've got marionette lines, which means these are grooves which appear from the angle of the mouth downwards, if you've got that, or if you've got jowls. So I mean, you get bulge here in this area, and that is those are jowls, and that means that the sag has happened in that case. You could be having a lot of lax skin in the neck. You could have platysmal bands. When you tighten the neck, if you see muscles forming bands, then those are platysmal bands. Those are also patients who could benefit from a facelift procedure. Facelift procedure is very popular abroad, US and Europe, and they do it maybe in their mid 40s or even earlier nowadays. And those who are in the limelight or in front of the camera all the time, they would want to do it more early and more frequently. So you can repeat the procedure. You can do it every 8 to 10 years. And there in the West, you will find that there are some people who have had 2 or 3 facelifts in the course. So because they've started early, they want to maintain the look. They don't want to see a huge change in their facial appearance. So they don't mind getting small facelift procedures every now and then. In India, one would not do a facelift till the signs are very noticeable. But then if you do a facelift, then the change is very dramatic. There's nothing as dramatic an improvement as the one that facelift gives when you compare it with any of the other non-surgical procedures. So it is considered the ballpark or the gold standard in facial rejuvenation procedures. And then you have all the other non-surgical procedures which we are covering in some other video. So this is what facelift is. But facelift is a fairly skilled procedure. It's done under general anesthesia. It's usually done in the hospital as an admitted patient. You can take anywhere between 5 to 8 hours depending upon what all components are being treated along with the facelift. So facelift can be combined with your eyelid tuck, or it could be combined with a brow lift, a lip lift, or even a chin augmentation, and various other things can be done along with facelift to get maximum improvement. I do all these procedures together and I call it comprehensive facial rejuvenation, when you're combining brow lift, eyelid tuck or blepharoplasty, and face and neck lift. I also combine fat grafting to take care of the deflation or the loss of volume that has happened, and you get the maximum rejuvenation possible by combining these procedures. So it's a 8 to 10 hour procedure. Obviously, overnight stay is required for a couple of days at least till you are comfortable to go home, and then after that recovery is straightforward. Wounds heal in around 7 days time, and stitches come out in 7 days time. I think we will cover the post-operative recovery in another video. So for this should be enough, and if you like the video, please don't hesitate to click on the like button, share and subscribe if you want to see more content like this. Thank you.